In this video, I'm going to talk about appetite and chemotherapy, appetite and going through cancer treatment, but most of my remarks are going to focus on chemotherapy and on hormonal therapy or antiestrogen therapy. I need to make a couple points. One is if you have had a problem with eating, an eating disorder, or body image issues, I'd like you to think about getting support, even maybe before watching this video. Write down some notes and reach out to somebody who's been involved in your care before, because conversations like eating around cancer treatment can be activating. So I just want to say that up front. The other thing I want to say up front is that there's a lot of body shaming in our society, and it's really important that you not take my remarks as some kind of prescription for you to be a skinny person. A lot of our measures of obesity are based on old white people in Belgium. They're not on people from different cultures and different backgrounds in different parts of the world. So this whole topic is a little bit fraught for me and for many people, my patients, and many people who are friends of mine, people I've learned from. So that being said, chemotherapy can affect your appetite. It can make you want to eat more, which is a surprise to people, and it can also decrease your appetite. Why would it make you want to eat more? Well, a couple reasons. One is, right after chemotherapy, nothing tastes good. So when your taste comes back, now you're like, I'm so looking forward to eating X, and your appetite goes up. The other thing is we use corticosteroids as a key way of preventing you from getting nausea and vomiting, and corticosteroids also increase appetite. Now, you're on them for a very short time. You're only on them for 3 days, but you may notice that your appetite goes up, and that can be distressing for you. It should go back to normal. The other reason to talk about chemotherapy and appetite is because we're much less active. People tend to notice if they have a smartwatch or a pedometer, they're not moving as much during chemotherapy. They're spending more time going to doctor's offices, people coming and bringing them food, and less time doing their normal activities. I know if I'm not at work, I walk many fewer steps. So if you're taking some time off of work, you're going to be less active. And so we find that sometimes we see people's weight go up. I'm bringing this up because it can be distressing. And if you want that not to happen, you can work with your team to stay on top of your weight and be seen by a registered dietitian. You can talk about this in a support group. So if this is important to you and you haven't struggled with an eating disorder, or even if you have, partner with your team. You don't have to be on opposite ends of this. Now, what happens if you lose your appetite and it doesn't seem to be coming back? That can be very distressing for people. First of all, the way people show love is by giving us food, and if the food doesn't taste good or we don't want to eat, that feels like we can be rejecting a gift. Also, we gather around meals, and if your appetite's low, that can be upsetting to your family. And also, if you're missing out on something you used to enjoy, there can be grief around that. In general, this is temporary. If you're living with advanced cancer, this may actually be a sign that you need to talk to your doctor about the status of the cancer, and does a change in your treatment need to be made. Now, with antiestrogen therapy, we put people into sort of a, well, it depends. If your ovaries are still functioning and you go on antiestrogen therapy, we put you into what is often called a chemopause. It's a temporary menopause. And when we go through the menopausal transition, when our ovaries go from working to not working, it's not uncommon for people to put on a few pounds. So if we're messing around with your hormones, either because chemotherapy is making your ovaries not work, or we're giving you antiestrogen therapy, it's not uncommon for your appetite to stay the same, but your weight to go up a little bit. That tends not to continue, but you might notice that around the change. And if you are already living with ovaries that stopped working, then you have probably already experienced weight changes, and it seems like our energy needs go down when our ovaries aren't working. Our energy needs also go down just with time, so we generally need fewer meals and smaller meals to maintain the same weight. I want to be really supportive of you as you go through this. I, again, don't want you to feel that you have to maintain your weight, but if this is something important to you, there are ways to manage your weight. And also, when treatment's over, you can make that a goal for you, is to get back to being healthy and fit if it's not sustainable for you to maintain your weight during treatment. Thanks for watching. I hope this gave you some tips and some ideas about what's going on in your body and that you're not alone in this. If this video has been helpful to you, click like and subscribe so other people can find it. And if you want to learn more about your treatment options, go to Yerbba.com to download your personalized report.